Affecting both young and old, scoliosis is a condition that causes your spine to form an abnormal curvature up to a certain amount of degrees. Now, to help us understand scoliosis better with us is Dr. Larry Acuña. He is the head of the spine section at the Medical City. And we also have Dr. Jericho de la Cruz, who's a rehabilitation medicine specialist from the Asian Hospital and Medical Center, as well as the Medical City. Now, start first with Dr. Larry. Dr. Larry, let's talk about the normal spine for a second here, because a lot of people have this misconception that our spine needs to be perfectly straight. Describe for us what a normal spine should look like.
It should be straight up to 10 degrees. So below 10 degrees is normal. And in the sagittal view or if you look at them at the side view, there's a certain curve, the neck, the thoracic, and the lumbar, which is usually like an S shape, and the lateral view.
Now let's talk about what scoliosis is. Dr. Larry, could you talk about what happens when someone has scoliosis?
So if you have scoliosis, to define it, it's a lateral deviation more than 10 degrees. And it depends on the amount of angulation where treatment is necessary and also the age.
Dr. Jack, I'd like to ask, a lot of our viewers may think about scoliosis and think also if this is synonymous doon sa term ng pagiging kuba.
Scoliosis is on when you're looking at the person, yung angulation, pagpaharap, no? So, lateral, side to side, left to right. Yun yung angulation. So, more than 10 degrees, you will consider that as scoliosis. Yung pagiging kuba naman, or pagiging bayukos, it's on the front, paharap. No? So, nakukuba siya. So, it's a different plane in terms of viewing the patient. No? So, it's on front to back angulation of the spine. No? So, it's more on kyphosis naman ang tawag doon.
Now, Dr. Larry, earlier you mentioned that it normally happens at a certain age. Let's talk about that. Ang scoliosis na nangyayari sa pagkabata, ito ba ay isang condition that is namamana? Napapasa ba ito from the parents to the child? And kapag nangyari ito sa isang bata, what are some of the reasons why this should be addressed?
Yung scoliosis, only 10% of the time namamana siya. Kaya sinasabi namin na idiopathic because they really don't know what's the reason behind it. But most of the scientists now would tell us that it's multifactorial. So in most of the studies, the 10% lang yung cause na namamana. But sometimes we usually ask relatives kung meron sila o hindi.
Now, pag-usapan natin yung scoliosis sa mga adults, Dr. Jack. Is it possible that scoliosis could be acquired by an adult when they didn't have it nung pagkabata sila?
So, acquiring it in the adult period, medyo hindi nangyayari, no? Unless you have a different problem with the spine. No? Like, for example, a fracture in the vertebral body. So, pag nag-fracture yun, bumagsak, and then your spine started to curve towards the right or the left, then that could be considered scoliosis. No? Pero usually, scoliosis is acquired during childhood, no, especially during the time na lumalaki ka. No, once you have your skeletal maturity, medyo hindi na gumagalaw ang spine natin.
Let's talk about now the symptoms, some of the symptoms that may point towards a diagnosis of scoliosis. Dr. Larry, could you talk about kung anong mararamdaman ng isang taong merong significant deviation, more than 10 degrees, either to the left or to the right? What type of movements are impaired because of this?
Yeah, for young patients, they don't have symptoms actually. You can only notice them with a kind of deformity like meron silang shoulder imbalance. Tapos pag pinatayo mo sila, yung arm trunk distance, yung sa may axilla, sa may kilikili, uneven yon. And then pagka pinag-bed mo sila, mas elevated yung isang rib area. So that's we call it rib hump.
For those who discover that they have scoliosis later on in life, they've had it most likely since their childhood days, is it possible that it will progress to more, kumbaga yung deviation nila will become even worse, will increase in the amount of degrees, if it is not addressed?
So, sa adult, pagka late mo na siya nakita, no, anything less than 30, most probably it won't progress anymore. No? Pero if your angulation is more than the 30 degree, medyo may possibility siya na mag-progress. But if your spine is healthy, there's no problem, like what I said kanina, kung hindi ka magkakaroon ng injury to the spine, and then the possibility of increasing the angulation of the spine is very minimal.
Dr. Jack, I'd like to ask also, what are some of the tests that a person should take in order to get a proper diagnosis for scoliosis?
Sa child, no, usually we will ask for X-ray of the spine, and then most probably a scoliotic series to see if it's reducible, no? So, several X-ray films to see if the spine is, how do you say it, sumusunod, no? Sumusunod or nagre-reduce yung angulation. Sometimes, if you're worried that there is something else that's causing the angulation of the spine, you may ask for an MRI or a CT scan.
Coming up, we'll discuss some possible outcomes if scoliosis is not addressed properly. Only here on Medtalk Health Talk. We'll be right back.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement, gama sa Davao para sa Mindanao. SMC Davao Cement, ato ni bay. SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement, gama sa Davao para sa Mindanao. SMC Davao Cement, ato ni bay.
Ito ang RPN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
Are wary, especially yung mga pumapasok sa school, mabigat ang backpack, maraming libro, maraming dala. Could this be a cause for scoliosis?
Walang one particular reason with regards to the cause of the scoliosis. When posture is involved, you might think of the spine as a tree, no, para siyang puno. So when you start pulling the tree to one side, it will curve that way. So especially on the child on the growing years, kasi may mga times tayo nag-growth spurt, no? So during childhood, nung mas bata tayo, and during the adolescent years. So once you start having this bad posture, the tendency of the spine is to curve towards one side of the body, no? So pakaliwa o pakanan, it depends on the posture of the child.
Dr. Larry, when it comes to the degree of angulation, you mentioned a cutoff point where it becomes severe, where surgery is addressed. But what about those na yung angle nila sort of lies between mild to moderate? They have some aesthetic nuances nakikita externally on them. What type of treatment is viable for them?
If it is noticeable already, nasa moderate stage na siya, usually mga 30 degrees na siya. But when you catch them early, like 10 degrees to 25 degrees, proper exercises and muscle strengthening would be the proper treatment. And we give them to rehabilitation medicine so they can prescribe proper exercises and muscle strengthening. For young patients like 10 years old to 14 years old, you have 25 degrees to 40 degrees. We require them to have a brace to prevent it from progressing and somehow correct the deformity.
Dr. Jack, Dr. Larry mentioned na mayroong mga exercises na ginagawa pwede gawin sa bata as part of the therapy in order to correct mild to maybe moderate scoliosis. What types of exercises do you do to your patients kapag nasa range siya na ganito?
We have this thing called the claps exercises. So that's the exercises for the angulation of the spine. So it depends on the apex, no? Which means kung saan umikot yung spine, no? Yung vertebra na umikot to make the spine angulate to one side, no? So it really depends on that. Then there are several exercises for that. Proper posture, kailangan din i-enhance yung posture ng child so that the spine grows upright, no? Hindi pa side. And then you have your core muscle exercises to strengthen the back, the abdominals, the legs, and the arms.
Now, Dr. Larry, I'd like to talk to you about osteoporosis and scoliosis. Is there a connection between the two?
Yeah, some of the studies would tell us that mas prone yung scoliotic patients to have osteoporosis. And the other thing is, you have to prevent osteoporosis among patients with scoliosis. Kasi in the adult years, there's the reason why the curve of scoliosis progresses with osteoporosis.
So, Dr. Larry, just to make it clear, no, osteoporosis is seen in those people with prior scoliosis, not the other way around. A lot of people might think that scoliosis was caused by their osteoporosis, especially for those in their senior years where osteoporosis is more commonly seen.
Now, the osteoporosis is mainly because of the imbalance between intake and egress of calcium in the bone. So the bone quality decreases as you age, and there's an effect of postmenopausal usually among women because of the estrogen effect. Then it does not, the scoliosis does not cause osteoporosis, but in scoliosis, among patients with scoliosis, there's a high incidence of osteoporosis.
Now, Dr. Larry, could you share with us some of the complications that come with scoliosis?
Scoliosis per se is not a disease. It is a deformity that when left untreated and became severe, it affects your pulmonary function and will develop restrictive lung disease.
Dr. Jack, when it comes to trying to prevent someone from having scoliosis, trying to minimize the progression of this, is there anything that is really viable, or is there something that people can do beforehand in order to prevent scoliosis from happening?
So if you're active, you grow muscles, you grow in strength, no? Tumitigas yung laman. So you get more muscular, especially if your family has scoliosis, there's a propensity that you will develop scoliosis as well. But if you practice proper posture, you're active, you exercise a lot, then most probably mas maaagapan siya.
Coming up, we'll discuss the proper treatment and more prevention tips for scoliosis. You're watching Medtalk Health Talk.
And has inherent risk on it. Especially, pwede ka mag-cause ng slip disc, pwede mong maipit yung mga spinal nerves, doon tayo magkakaroon ng problema. And then it can cause other problems other than the ambulation.
Advice for our viewers here who may think their child or themselves have scoliosis: always get the correct diagnosis from your orthopedic surgeon or from your rehabilitation medicine specialist before you try and do any procedures. Okay, Dr. Jack, could you talk about traction procedures for those who are trying to look for a solution for their scoliosis? And also, could you talk more about the back brace that is prescribed for those with scoliosis?
So, with regards to the traction, there's two schools of thought. No? Merong nagsasabi it works, may nagsasabi hindi siya nag-work. No? So, basically, it cancels each other out. So, minsan, kwento namin, kanya-kanyang paniniwala ng doktor. No? It won't cause any harm, but sometimes it doesn't cause any good. With regards to the brace, mas maganda kasi naka-brace. No? It depends on the angulation that you really have to wear this brace 23 hours a day. So, in effect, it nagko-cause ng konting traction ang brace to keep you upright, and it pushes the angulation towards the center. Kasi yung angulation, parang hinihila ka lang pataas. As compared to scoliosis, again, it's left to right curvature. So you have to push the spine towards the center. So para ka nagta-traction in effect when you're wearing a brace.
Dr. Jack, let's also talk about the strength of the muscles, good exercise, being overall active. How does this benefit someone with mild, maybe moderate scoliosis even?
So kasi our spine is technically it's the backbone. No? It's called the backbone, and the muscles are attached to the spine. No? So when you start building the muscles, then it has the support. It supports the spine. So hindi siya masyadong gagalaw. If your muscle is very taut, no, matigas siya, or you're very active, tas malakas yung muscles mo, hindi siya masyadong gagalaw. pantay lang dapat.
Thank you very much, Dr. Larry Acuña and Dr. Jericho de la Cruz, for being with us today and sharing your tips as well as your expertise about scoliosis. I'm Dr. Freddy Gomez, and thank you for watching Medtalk Health Talk. We'll see you again next time.
SMC San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Ito ang RBN Radio Philippines Network, DXKT 1071